Good afternoon, everyone. Looks like we still have several people joining. Thanks to those of you who have put your name in the chat, letting us know that you are here. Looks like we don't have anyone on the phone just yet. We should get started in just a few minutes. I want to give a chance for more committee members to join. And Rachel, I'll let you know when we've got a quorum. Thank you.
Thank you.
So again, for those who just joined, we're just waiting a few more minutes to let folks join. If you are a committee member, if you would put your name in the chat, let us know that you are here. If you are a committee member who's on the phone, if you would unmute and also let us know that you are joining us. We should join in just a few minutes and waiting for another one or two more committee members.
Sharon, this is Jennifer Brinton. I'm here. I just had to be here by phone. So.
Wonderful. Thank you. Okay, so by my count, Rachel, we do have a quorum, so you can proceed. Thank you.
Thank you. Okay. Welcome everyone to the November MAC meeting. We have the agenda up right now, but I think first order of business is I'll take a motion to approve the October 2024 minutes. Anyone?
I'll move to approve. This is Kim. Sorry.
Thank you. No, that's okay.
I'll second it.
Thank you. Okay, perfect. So that has been approved. And then we'd like to thank, I don't know, is Gina on right now? We'd like to thank Gina Tuttle for her service to the MAC. Her term just lapsed. So we just want to recognize the work that she's done here the last few years. So thank you, Gina. And in that same vein, we are accepting nominations for a consumer representative for individuals with disabilities and a provider representative for long-term services and support facility-based care providers. There is a MAC flyer that was sent out with the meeting materials that can be sent to you as well if you didn't receive it, to publicize that position. And then also back members, we're also asking for back members as well, the beneficiary advisory committee or council. We'll get used to it, but those flyers were included with meeting materials. So if you know folks or have, a place to put those up at your own organizations to encourage people to apply to be MAC or back members, we would greatly appreciate it. And then I think we just move right on to, no one has any questions right now. We can move on to voting on the new MAC bylaws. And that is Medicaid Advisory Committee, not Medical Coverage Advisory Committee. So I know we've had discussion about this. No actual changes to this were implemented. They from when we reviewed them at the last meeting, but everyone's had a chance to review that. So Sharon, this is my first vote, so I don't want to mess it up.
So if you like, I can do it by roll call. I am, I kind of set it up that if you wanted me to do it that way, I can, or if you want to do it, just everyone say yay and raise their hands, and then any nay votes, they can do it that way. So whichever you prefer, it's up to you, Rachel.
Okay, let's do it let's do yays and nays first, and then if we feel like we need a roll call, we can do a roll call.
Okay, sounds good.
Perfect. So all in favor of adopting the MAC bylaws, please say yay.
Yay.
Yes.
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 Yay.
And any nays?
I'm probably a nay. I do think that we should have a member for both skilled nursing facilities and for home health. So I would prefer to see us adding a member to the committee to represent those interests.
Yes, and yeah, I know that was kind of our main discussion about these. I'll reiterate that I think adding more providers puts us in a position of adding more consumers as well. That has been historically pretty hard to do, and a lot of folks already are sharing seats. Physician seat is a huge one, I think, but I understand why and appreciate your continued advocacy.
Thank you.
And then Sharon, are we good to go on that?
Yeah, so I mean, if there was just one nay vote, then the majority voted yay, so that would pass.
Okay. And then we can move on to the same thing for the back bylaws. So you've all had time to review these as well. So all in favor of adopting the back bylaws, please say yay
Yay.
or aye.
Yay.
Yay.
Any nays? Okay, so thank you all for that. I believe that has been, both have been adopted, and we can move on to agenda item number 4. Colby, if you want to go over the media campaign.
Sure thing. Let me get my screen presenting here. Okay, I think you should be able to see. I have been asked to go over the state fiscal year 2024 children's coverage outreach media campaign. So this funding, if you remember, was passed during the 2021 general legislative session. It was ongoing funding in House Bill 262 to promote both children's Medicaid and CHIP to children in the state who may qualify for the programs. And generally, it was just to increase awareness and educate about these programs to low-income or uninsured families. So we've been doing this work ongoing we're currently in our 4th year. This would be our 3rd year. For this year, we started in September. So this is September through the end of June. So you can get a snapshot of like when the campaign was airing and rolling. We used the following campaign tactics: online advertising using social media, but also display and search ads. We use TV, including YouTube pre-roll. So those are the ads that roll before you watch a video. And then CTV, which is like streaming television through smart TVs or gaming consoles. And then cable television was also included in the TV tactic. The next one was direct mail. We were able to target specific households based on demographic information. We were able to engage in outreach activities, both grassroots, and then we also conducted mini grant awards that were able to then target specific groups. We used radio and outdoor, both billboard and transit. And then we were able to do a little bit of research this past year. And this is all with the help of Target River, who is our contractor, advertising and marketing contractor. I'm just going to run through each of these tactics. If you have a question, please feel free to raise your hand. This first one is online. Like I mentioned, we had used various tools online to specifically target our demographic or people that we think may be eligible for these programs. Everything is done in English and Spanish, and you can see here in some of the data, the impressions overall, we had over 29 million impressions and in English, and then 23 million impressions in Spanish. And then those are broken down below based on the actual source. So whether it's, Instagram or Bing ads, for example. And this is a sample of the ad that was used in both English and Spanish. And we are constantly testing the ads to make sure that what's being used is effective. So if there's language that we find it receives more interest or more clicks, then we will reuse that language or we'll tweak it to get the best bang for our buck, essentially. The next tool is TV. So I mentioned the different TV tools that we paid for advertisement. Now, one thing that's impressive here is, for example, the CTV, the view completion rate. That means the percentage of viewers who watch the video in its entirety. So, when you're starting a video on YouTube and you can skip after a few seconds, 89% actually watch the entire video on CTV, and then 65% did the pre-roll. So that's YouTube pre-roll. So that's actually pretty great rates of completion. I'm going to show one commercial. Rachel, if you give me a thumbs up if you can hear it, because we've had some technical issues before.
Hey there, parents. Meet your healthcare superheroes, Medicaid and CHIP. Low cost or free healthcare for your kids and teens. Medicaid and CHIP will keep your kids protected with comprehensive coverage while protecting your budget from unexpected medical bills. Apply today at coveringkids.utah.gov or call 1-888-684-1599. Let Medicaid and CHIP save the day for your little sidekicks.
So that's an example of an ad that was used in these formats.
Hey there, parents. Meet your teenagers. Meet your healthcare superhero.
And then that one. Okay, there we go. The next tactic is direct mail. We sent over 20,000 postcards to targeted households that would likely qualify for the program. And this postcard was offered in English and Spanish. So English on one side, Spanish on the back. Last year, if you'll remember, there were several messages that we were really trying to share. So we had unwinding, which was, we wanted to help families who may have lost coverage or needed to complete their review to do so that they wouldn't lose coverage. Families who did not have health insurance, we wanted to inform them of this program. And then also State CHIP was a new program in half of the year starting January 1st of 2024. So there was a lot to pack in as far as messaging last year. And we wanted to make sure that we were, using messaging that hit all three of those audiences in those buckets. So you'll see here there was a little combo approach on this direct mail piece. The next was targeting different community resources that really are on the ground with families who may qualify. So that included school districts, charter schools, private schools, youth sports groups, churches, chambers of commerce, community partners, rec centers, food banks, YMCAs, WIC, and the Boys and Girls Clubs. So all of these groups we were able to get contact information for and then send them an email with specific flyers related to those three topics that I mentioned in the previous slide that they could then distribute to their audiences. So we know that these groups are a trusted resource for many families, and sometimes disseminate information through those trusted resources are the best way to capture the ear of our audience. And so we wanted to make sure that they were hearing the message through multiple channels. We attended many outreach events. This is just a quick capture. It's not all inclusive. From July through June, the entire fiscal year, we were out in the community attending events, tabling, and passing out information, also collecting applications where we could. This is just a little snapshot of some of the visual displays that we had. We had a pop-up banner. We created stickers and chip clips for our chip program, and a little picture of our event setup. This funding also provided us the resources to hire a full-time outreach specialist who was able to attend events, provide specific trainings to community partners in both English and Spanish, and then find opportunities to really get into these hard-to-reach communities. I had mentioned earlier that the mini grants were another grassroots outreach method that we used and implemented this past year. We gave $5,000 mini grants to 14 community groups. They submitted an application justifying how and why they would use the funding, and then they provided a report at the end. We provided them with materials, like hard copy materials that they could distribute, so that wasn't a pain point for their limited resources. This includes various groups, including both school districts, churches, rural and populations that are harder to reach. And I was going through the final reports of these groups and was really, quite honestly, touched in how they were thinking about how to best reach their target audience, and so impressed with the work that they did, setting up, real specific groups. There was one, I think it was Holy Cross Ministries, that offered pre and postnatal groups for mothers in their community, and educated them on these programs that are available for themselves and their children. And they, there was enrollment events that were set up specifically by these groups. So they were on the ground, knowing how to best reach their community. And I just can't say enough good things about the work that was done through this effort. The next tool we used was radio. You can see the impressions here for English was over 700,000 and Spanish was over 189,000. It was split into 2 markets. Okay, so sorry, I read that wrong. Streaming audio. So this is audio through your internet. And then we also had terrestrial is what they call it, radio, Salt Lake City, and then the Southern Utah markets. And I'm going to play one ad quickly for you. See if I can get that started.
Introducing Medicaid and CHIP, the superheroes of healthcare for your kids and teens. Medicaid and CHIP will keep your kids protected with free or low-cost coverage, like doctor visits, emergency and hospital care, prescriptions, dental care, and more, all while protecting your budget from unexpected and expensive medical bills. Apply today at coveringkids.utah.gov or call 1-888-684-1599. Let Medicaid and CHIP save the day for your little sidekicks. Introducing
the next tactic we used was outdoor advertising, so both bus, transit, and billboard. We had 24 billboard locations. They were targeted by areas, specifically low-income areas, and then they were rotating. So it got a lot of good reach. You can see the impressions for billboards was over 25 million, and the bus was over 19 million. So that was quite effective this year. One of the transit ad employees actually sent us a message wanting us to know that he was formerly a Medicaid member. He got Medicaid when they had their child, and what a lifesaver it was for their family. And he just really felt that transit was a great way to get the message out, because the ridership was there was a lot of ridership using this that would likely or could be eligible and just uneducated about the availability of these programs. So we appreciated his support. As you know, we did some research last year, and we've already presented on this. It was a research report from Lighthouse for CHIP families who had disenrolled, and that is available on our website. Finally, we created numerous materials, updated materials. We created the Covering Kids website in both English and Spanish. There are 2 separate websites for the languages, and we created flyers that were distributed for all these events and activities. And then we were able to update all of our CHIP materials. So with the new consolidation of departments, we needed to update for the DHHS branding. So we were able to do that with some of this funding, a CHIP website, CHIP poster, flyers, so that everything is now in compliance with that. Overall, the campaign was quite effective last year. We were very pleased. We had over 99 million impressions total, 125,000 clicks on the website. which we tracked events where people showed interest by either clicking on a button like apply now or call for more information. Over 100,000 video views just on our website alone. And then there were over 2,000 calls to our health information hotline. This year, we're going to be adding another piece of data. We're going to be adding information on the Medicaid website, the Medicaid application through DWS. So they will be able to click where they heard about the program. And we hope that this data will give us a better idea of where people are hearing and learning about the programs. And there will be a little drop-down menu on the application. Now, this will only be available for people who apply online, but we hope that it captures a little bit more information for us to use. And that wraps up my presentation of this past fiscal year. We are rolling in the next fiscal year. And so if you have thoughts, concerns, recommendations, we'd love to hear it because we have about 6 months to get it implemented. And then the funding actually sunsets. So we will not have this funding after July or the end of June of this year.
I'll just say, Colby, thank you and good job to you and everyone else that worked on this. It looks really great. I saw some of this too. So I'm really happy to see it. I know Steph had mentioned that she had seen it as well. So just really impressive. And thanks to all the mini grant participants as well. But does anyone have any questions for Colby? Any suggestions?
So thank you so much, Colby. I saw the buses and the YouTube and the Facebook. I also got people that sent me screenshots of them getting the messages. So I'm really grateful for the efforts and for the mini grants and everything. So is there any effort to try to get the legislature to renew this annually, or is that I'm guessing, I don't think the governor's budget has come out yet, but is that something that would be helpful for the health plans that have lobbyists or just people that have lobbyists, if they could lobby for the SSA to give you all this every year? Or I guess, what is the efforts to continue this? Because I just think the outreach part is so important for beneficiaries.
Yeah, we certainly still see the need, especially after unwinding that families, there still may be some confusion and disenrollment that we would love to have funding ongoing. I do not know if there has been a request, Jen, if you want to jump in, but I know that we've certainly discussed how this ongoing funding would be awesome to continue.
Yeah, thank you, Colby, and great question. And I concur with Colby that we've really appreciated the work that this funding has done to contribute to really reach members through multimedia. The governor's budget, as I'll announce shortly, has not been released yet, so we don't know if there's interest in funding it through there. There was a report put to the legislature this summer through interim committee that did discuss the campaign itself. We had lawmakers who were asking us questions. Colby had many questions back and forth from lawmakers who were interested in the program contents and the results, some of what she presented today. So there has been dialogue through the committee and other lawmakers who certainly are aware of the campaign, but there's no information that we have with regard to ongoing funding at this time.
Thanks, Jen. And how much did it cost, in total, if it was to be asked for again, or for annually?
I don't, Stephanie, I can get back to you on that. I don't have that breakdown, the funding breakdown, the state funding specifically.
Okay. Thanks so much. And thanks again. I really think this is super valuable. So I appreciate the updates.
Rachel, you're on mute. I can see you talking, but we can't hear
Thank you. I was really confident I wasn't. Colby, thank you so much for coming by and giving us that presentation again for all you. Thank you to you and everyone that worked on this. I think with that, we can move on to agenda item number 5, which is an eligibility and enrollment update from Michelle Smith. So Michelle, I'll hand it over to you.
All right, thanks, Rachel. Hi, everybody. I'm going to go ahead and present on enrollment. So let me get this pulled up. Okay, hopefully you all can see my screen okay. So I have it on persons. Again, for those of you, I do this every time, but some of you may not be aware that this is available on our website. So I'll drop the link in the chat for you all. This gets updated every single month. And if I look at total enrollment, currently we are at 342,876 individuals. If I look at last month's, we were at 347,380 individuals. Now, keep in mind, again, we do have individuals who come back on, over the 30 and 60-day period with redeterminations or providing information that was outstanding still. So that this number that currently shows for October will likely increase over the next month or two, but that is what we currently show. If you look at the individual program enrollment counts, there really isn't anything that stands out. Everything looks pretty on par with what it has been. It looks like we're definitely leveling out in terms of any sort of big drops in our enrollment numbers. Next, well, I guess I'll pause there and just ask if there's questions or anything anyone would like me to focus on with the enrollment before I go to the next. Nope. Okay, I don't see anything. Okay, so next I will show our eligibility data dashboard, which is the outcomes that we still report monthly to CMS. As you can see, we're still doing really, really well with our ex parte rates. We are at close to 40% completion for our reviews with ex parte, which is really good. So our automation has been fantastic, and we're making really good progress with that. There's still, some movement. Obviously, the movement from Medicaid to CHIP has definitely gone down since the unwinding period has ended, but that's to be expected. So we're kind of probably more in a normal area of movement. This is returning members and new members on this tab. Any other DWS activity. You can see presumptive eligibility applications, with unwinding went up, kind of started going down, and then this last month they went up again. So we've seen an increase in those applications. For DWS call volume, it looks like those numbers are doing really, really well. I don't necessarily want to talk about this. I know, Melissa Presley, you're on the call. I don't know if there's anything of note to make here, but I think the call wait times have gone down, which is really great. We're at 16 minutes. And then the abandonment rate as well has gone down to 20%. So I'll pause here. I don't know, Melissa Presley, if you had more you wanted to add on these at all, or if anyone has any questions for us. Okay, I'm not seeing any. So I'll jump over to here. Just another plug and reminder on the 1115 dashboard that we now have in place on our webpage for those of you who wanted to see ESI, so employer-sponsored insurance enrollment, and other programs that are under the waiver. Again, as you look at this, there's an enrollment tab here as well as a benefit, because obviously under the waiver, we do have, like, for example, housing-related services and supports, UMIC, some other things like that. So this is a great addition to our 1115 webpage to show that enrollment. And Daryl, I just saw your question in the chat. That is not true. So if you want to get with me offline for that question, I can, if you have some more specifics on that, and I definitely can look more into that question. Okay. So I'll stop there. I just want to maybe mention to put a plug for next month. Yeah, thanks, Sarah. Just a plug for next month for Melissa Presley and I. We're really excited to be able to kind of show you all the one pagers that some of you have been instrumental in helping us put out there. So I just kind of want to put a plug on that. I think those one pagers to help with the application and review will be super helpful for everyone. So thanks.
Sorry, I lost track of my screen there. Thank you, Michelle. Any questions? I'd like to personally thank Michelle for and everyone that worked on the 1115 dashboard. I find it really interesting. That's what I was looking at, and that's why I couldn't find my screen. So thank you so much for putting that together. I'm looking forward to looking into it. Any last questions for Michelle? Wonderful. Then we'll move on to item number 6, a director's report from Director Shorhacker. So you have the floor.
Thank you. Hi, everyone. Appreciate the time to go through a few items that we have to share with you this month. The year is rapidly coming to a close as we're looking at now the November report moving into December. I believe, like with regard to our policy changes for this year, we have released several policies on November 1st that Brian covered in last month's director's report. So I wanted to give you some updates on the work that we're doing and keep you abreast of some active things we're working on. So at first, I'd like to start with our 1115 waivers. I'll spend a little bit more time sharing with you where we are with our justice reentry work and let you know where we're heading into the new year and some things that we've been working on over the last couple months. But first, I know that we're often asked, well, what is CMS reviewing right now? Where are you all at with your waivers? And I'll say that recognizing that we have a number of waivers in queue, we have the opportunity to work with CMS right now, both on 2 waivers that they have approached us about and we're actively engaging. And I wanted to share with you what they are. So the first is our housing waiver. This waiver was a request that was put in actually July of this year. And it expands our housing related services and supports and actually opens up our it actually puts a number of requests inside a new waiver type that's called health-related social needs. So, we've had our HRSS waiver, which has provided housing services and supports for individuals in the TAM population who meet the eligibility criteria. What this HRSN waiver request will do will expand our HRSS services to the justice involved population who have been involved in the carceral system for up to the last 12 months. So if a person has been involved in the carceral system and they've been out for up to 12 months, they may be eligible for HRSS services. It also expands these services to adult expansion members. So that is one component of the HRSN, health-related social needs waiver. Another piece that you've heard about in the past and we've talked about, but we have not yet received CMS approval for is our medical respite request. So medical respite was something that happened now over 2 years ago. We had submitted a request looking at helping individuals who are moving out of a skilled care setting like a hospital or nursing facility, and they're at risk for housing instability or they are homeless, yet they still require a home health level of care. And medical respite underneath this request would be provided for an individual to provide housing supports and home health level of care services. So the reason it wasn't approved from CMS before is because there is a room and board component to this request where an individual does qualify for room and board as part of that coverage benefit, as well as the medical care services. And so that medical respite benefit is also included inside this HRSN waiver. And then last but not least is a rental assistance component. And for this, we're looking at requesting approval for up to 6 months of rental assistance for qualifying TAM and adult expansion members who do meet our housing services. So the survey that right now is administered to members who qualify for HRSS, our vision is that we would administer the same survey to individuals assessing for housing instability and other measures or elements that are included in that. And that would also be applied for individuals who are applying for this rental assistance component too. So I'll just say we are just beginning conversations with CMS about this benefit package, but we're really excited about how that may improve services and address really important health-related social needs for our Medicaid members. The next piece that CMS is working with us on is our adult expansion dental waiver. So you all may recall that last legislative session, so in 2024, this is a new benefit for adult expansion members to be eligible for a full range of dental services. This would be run through the University of Utah School of Dentistry. So it would pair beautifully along with our adult individuals who are elderly or disabled, and our TAM population right now, who is currently qualified for this benefit. It would expand that for adult expansion members as well. And subsequently, it would actually allow all adult Medicaid members to receive their dental benefit, to be eligible for dental services. So just wanted to let you know we're actively working with CMS on these 2 waiver requests, and our teams are excited about this engagement and look forward to what that means for our program. So I wanted to share that with you, since that is a new conversation that we began recently. I'd also then like to give you just an update on some of our justice work. There's a lot of activity happening on the justice front, and some of you I'm going to share my screen, and some of you have seen sort of this timeline before let me find it here. Sorry, I'm trying to share a screen here on my laptop, and it's not as easy to do. One moment here. But I would like to just orient you to where we are with this work. And I'm sorry, let's see if I'm able to get there. Okay, so I'm sorry, it's not in presentation mode, but at least you'll get an image of this timeline for you to appreciate sort of the body of work that's been done on our reentry waiver. So let me back up just to reiterate what our justice reentry waiver is. What this is, it's an 1115 waiver that authorizes pre-release Medicaid eligibility for individuals who are in a jail or a prison here in our state. So 90 days before release from one of these facilities, we will establish Medicaid eligibility. And at that point, when Medicaid eligibility is established, there is a justice benefit package that is specifically inside the 4 walls of the jail or prison that the Medicaid member can receive, and those services can be billed to Medicaid. So this justice benefit package is comprehensive. Utah has applied for and received approval to offer physical health, behavioral health, which is a full suite of mental health, as well as substance use treatment, pharmacy services, also laboratory services, oral health care. So all those services today that are being delivered inside the jail or prison can then be billed to Medicaid. At that time that the person becomes eligible, it is a requirement that we have care managers embedded within the jails or prison that will immediately begin working with the Medicaid member. They will first be educating the Medicaid enrolled individual about their benefit. They will be talking to them about their needs and what they qualify for, and they will be coordinating care with external providers, the managed care entities, as well as providers, to provide sort of a smooth path as they move from one setting to another, so that the individual actually has their needs identified and assessed, and then they have follow-up care in the community upon release. An essential component of this is that a care plan is developed, so that there is actually a physical care plan or an electronic care plan that establishes what that individual's needs are. That includes physical health, behavioral health needs, medication list, et cetera. And that care plan is what is actually shared with community providers and managed care plans, so that they're aware of the individual's needs. So with this, the care manager will coordinate closely with the member, coordinate closely with the community providers. When the individual does move from the carceral setting into the community, they will do so with medications in hand. So it is a requirement of this program that they leave the facility with a minimum of 30-day supply of medications, and that when they do that and move into the community, that helps with transitions, so that if there is time when they can see a community provider, that they have medications to carry them through until that follow-up occurs. So that's what the benefit package that we were approved is. And I'll also note that this applies for all of our adult facilities, but we are also implementing a like benefit in our youth juvenile justice facilities as well. And we've spent extensive time going through sort of the requirements for our juvenile justice facilities. There is, just if I could say, our juvenile justice facilities have a smaller requirement that they have to meet by January 1st, but states have the opportunity to do a more comprehensive policy or benefit as part of their 1115 waiver, and Utah is going to do that. So, but we're going to start first with our youth with that smaller screening and care management requirement on January 1st, and I'll bring that to our next meeting. Regardless, where we are today, so I'll just say that today we have kicked off stakeholder work group meetings that do engage decision makers and leaders in our community, that are lawmakers, directors of our behavioral health programs, as well as our managed care entities. We also have involved in this representatives from the Sheriff's Association, county officials, Department of Corrections, and also those individuals who are providing care within the jails today. We also have peer support representatives and community voice as well. These stakeholder work groups were kicked off in it meets once a month. We meet at the state capitol building, and we have monthly meetings. I will share with you, if I could, our website that does include all of this information. All of the information about these meetings and all of our resources about our justice program. We've created a justice landing page on our Medicaid website that does contain this information. If you're interested in calling in and listening and participating in the stakeholder work group, we do have designees who've been invited to be participants on this work group, but it's an open meeting, so you're welcome to join in and listen. We also have the notes from this meeting that we do post to the website as well. So if you want to just follow along that way, you're welcome to do that. It just covers, but it's really an important component of how we really do build this program and really envision the goals that we've established. Also, in addition to that, I have implementation team noted sort of in this bottom green bar. Implementation teams haven't really come together yet, because this will be closer to when we actually are really getting down into the weeds around the policies and the operational workflows. As we're looking with all the different stakeholders that are involved in this work, we're going to need input from our implementation team. So we're going to be building those in the very near future. So if I could just touch on an important milestone that we met by November 1st of 2024, which was the implementation plan submitted to CMS. So one of the milestones that we are required to meet as a Medicaid agency is that we develop an implementation plan. This is actually a template that's been put forth by CMS. It outlines all the required elements of the justice waiver from the time an individual walks in the door of a carceral setting. And when that 90-day mark happens, it really kicks in and identifies all those different elements. So it goes from eligibility reviews to care plan management, to identifying individuals' needs, coordinating care through reentry, working with community stakeholders. And it's a higher level document, a planning document, but it really does scope out all the required services that a jail or prison is required to fulfill prior to us receiving approval to go live with our first jail. So it's an as is and a to be sort of roadmap. And this implementation plan was submitted to CMS in October, and they'll take about 4 or 5 months to review this implementation plan and then provide feedback to the state. As I mentioned, this implementation plan is a very high level blueprint. It's our agreement with CMS, but we use the information that's in this implementation plan and translate sort of that CMS language into more common language that we will use to really develop our next steps. So with this, what's next on our roadmap is our facility readiness assessments. So we take the information from the implementation plan, all those required components, and what we're doing now, we've transferred that into what's called a readiness assessment for our facilities. So readiness assessment is a survey. And what we'll do with this survey is our goal in December is to distribute this survey that has all these required components for the justice waiver. It has all these required components outlined, and we're going to distribute this to all jails and prisons, and give them an opportunity to look through all these elements and assess where they are. Okay, so they will go through this workflow, and the way we have this, it's we're using sort of an online tool that they can receive, and they can fill it out partway, save it. They can go back in and continue working on it. But it has them think about what is your eligibility screening process today? How do you envision it from a software interface and a personnel? How do you envision putting that into place in the future? And it really does engage the facilities with sort of this kind of roadmap of what's needed to be able to be approved to go live. We know this can be a lot of interpretation and new things for our facilities. So what we're going to do after we distribute this readiness assessment is we're going to hold daily TA sessions where there's an open number for our jails, the staff, and the people who are filling this out and reviewing it to be able to call in and ask questions and get support and technical assistance in really, how do I answer this question? What does this really mean? Do you think the way that I've begun responding, will that meet the requirement? Am I on track here? So those are the types of things we anticipate as we're putting finalizing our review of the assessment and then getting ready to distribute it to the facilities. We want to make sure the facilities have all the adequate support and resources they need to be able to successfully complete the assessment. We're not necessarily going to put a deadline on when facilities have to respond to this. Our goal is that all facilities across the state do respond. We would love for all jails and prisons to be part of this effort in the 1115 waiver, but we recognize that some may not be ready to do it right now. So we'll be working with facilities, encouraging all to participate, but we'll be supporting them wherever they are in their preparatory process in their evaluation to get them to be able to come online. The other component of this is funding. And one of the things we're going to be talking about in the December stakeholder work group is some of the grant money and some of the opportunities we have to support the infrastructure needed for our facilities to come online. Our facilities might look at this and the jails might say, oh, I don't have an electronic health record today, or I don't even have a way to bill Medicaid. I don't have care management staff to do that work. Well, that's what some of our grant money is for. We have money that's been given to us through the waiver itself that is available to be able to help with infrastructure build. And by the end of December to early January, we would like to be able to offer this up as a competitive RFP for jails as they're going through their readiness assessment and they're being able to identify what their specific needs are, that they have the opportunity to apply for some of this funding. Now, the funding from the federal government is actually allocated over 3 years of time. So if jails miss the first pass this year, there's funding available the following year and another additional funding round the third year as well. So it does have a staged approach. So facilities can look at their timelines and their readiness, and they can do that. So we're going to discuss some of the funding details at our stakeholder work group. We can bring some of that here as well. But we recognize this is going to be some lift, and that there is some financial funding available to help support the jails and the prisons in that work. Medicaid is also applying for a grant, and CMS did issue a grant up to $5 million per state could be approved for states who are doing an 1115 waiver and are in those planning phases. We have our near final draft completed of our grant application. It is due to CMS next week. So we've been actively working on a 25-page grant application, really demonstrating our readiness and our needs, and really hopeful that CMS will look at our application and consider some grant money towards this work. Last but not least on this roadmap is a reinvestment plan. So this is another required component of the justice waiver where the state does submit a reinvestment plan. So what is a reinvestment plan? Really, what this shows, and there was a requirement that said when jails and prisons are able to get federal funding to provide these services, and they are billing Medicaid, which then brings in new money to the jails and prison and the communities that are serving these members, there's a requirement that states have to reinvest this sort of offset of this federal dollars that are coming in. We're required to develop a reinvestment plan on how we will reuse those monies that were offset from the federal dollars into improving the care for services and supports for people, for justice-involved population. So the plan itself is rather straightforward, but how we bring that into our jails and prisons and communities to really look at those reinvestment strategies will be additional work. But the plan itself to CMS, we're on track, hopefully to have that in by early December. So with that, I can stop presenting on the justice waiver. Wanted to just update you. There's a lot of activity. I'll just reiterate again our goal. Juvenile justice, we will come online in January and be partially compliant with some of those requirements in January. A lot of our processes in January will be more manual to screen for eligibility and be able to identify those eligible individuals within the juvenile justice setting. We will not be fully compliant until later this in 2025 with the juvenile justice requirements, and that's okay. CMS is giving us a glide path on that. But we hope to go live with our first adult facility in July of next year. So we're looking forward to that, but recognize there's a lot of work to get to that point. Okay. Next couple things I'd like to update you on is just something that we brought up in the past, and we had committed to bringing updates to you. So you are aware that the Office of Civil Rights has initiated an audit of our unwinding activities, and this has been ongoing, had been quite a time since we'd heard from OCR and had not engaged with them at all. And so it had been asked in a prior meeting, well, what's happening with the OCR audit? And we had said, we've had some back and forths, sent materials to them, had some interviews with them. But it had been quiet for a number of months. They did reach out to us a couple weeks ago, and we have had continued engagement. They have met with our teams, both with DWS and DHHS staff, and conducted some further interviews as part, I think, of their evaluation of our programs and services and in that time of unwinding. So just wanted to let you know there is some new dialogue occurring with OCR, and we'll keep you updated for any further changes that may happen there. But that has happened since we last met and talked about it. One of the last but not least things I wanted to mention was that our medically complex children's waiver had received additional funding through our not this past legislative session, but the year prior, increasing the number of available slots up to 900 children who could be eligible for this. We did meet that 900 mark in October of this year. And I don't know that that's something we talked about last month, but I wanted to share that those slots are now full. And so we do have the waiting list that is now in place for individuals. Last but not least, I mentioned it earlier, but we are still anticipating the governor's budget release within the next few weeks, and we'll be eager to update you on the components of that in our next meeting with you. So that's it for us here. Any questions? I can take those. Otherwise, thank you for the time. Okay, thanks, Rachel.
Thank you. So if there's no questions for Director Strawhacker, we are on to the last agenda item. So this is really kind of any committee member updates that anyone has. So I'll pause for a moment and wait to see if there's anything any committee members would like to add. Okay, seeing no additions, I think now that we've reached the end of our agenda, we are good to adjourn, giving you back about an hour of your day. Thank you all, as usual, for all your time. Our next meeting is on December 19th from 2 to 4. So we'll see you then. Thank you all.